this. I want to thank everyone for participating, both the attendees and the panelists. As you can understand, this was something of some urgency. The RHCA, along with our board chairman and other leaders, have worked with the county for the last few days to make sure that we continue to keep our job sites open and our workers safe. I can tell you that one of the hardest things is that it's a moving target at all times. Different areas and jurisdictions are under different kind of rules. The good thing is that the goal is the same for us, and that is worker safety and keeping our job sites open. There was a rumor out there that they were looking at closing the job sites, and we started calling our other organizations and calling our elected officials. A lot of these rules that we'll go over today that is part of Dallas County are rules that many of us have already implemented. Our job is to not only to make sure that we're promoting this, but also that we're moving this up and downstream to our workers, to our subcontractors, to other people. We all understand that we have a residential sector, a commercial sector, and a heavy highway, and there is some intermingling, but for the most part, they run in their own silos. And I think that a lot of the issues that have come up have been more on the residential side, simply because you have smaller companies and it's more difficult to access those small residential projects. And those are the ones, quite frankly, that neighbors can take pictures of and see things. On the commercial side, I'm happy to see that so many of our members and clients are already following these rules even before they came into effect. We're going to have some people on the call here to help us. We have Billy Naylor with McCarthy and Travis Taylor. Billy is going to help us to go over each point. Manny Rodriguez is the chair of the National Safety Council. That should be National Hispanic Contractor Association out of TOS. He wasn't based in Florida, but now he's based in Houston, but he's also in Dallas many, many times. And he'll help us with any questions that come up on construction. I do want people to know that we're not sending information in email, but only links, because this information is, it's just a moving target. Yesterday when we were on a call, we had several people that were upset that they feel like they weren't getting information in a timely manner. And that's because the information was being produced and going live almost instantly. Julio, Yolanda, and I worked on getting the email out yesterday evening, and around midnight, they made some updates to it. So we had to change everything on the website, and finally the website and everything went live around 3 o'clock this morning, I think. So take heart that we're all trying to do the same things. We're all trying to get the information out to everybody. So with that, I'm going to let Travis, Manny, and Billy introduce themselves, and then I'll go over our website. So we'll start with Travis.
Yeah, hi everyone. So I'm Travis Taylor, Regional Safety Manager for McCarthy here in the Dallas area. Currently we have 8 to 10 jobs right now going. 3 of them are currently in Dallas County, with Parkland being one of them, and Parish Episcopal School and Southwest Airlines down the street from Parkland. So I appreciate you having me. We're kind of learning as we go as well, but like you said, we're willing to share our best practices, kind of what we're doing right now, and sharing how we can help through all this.
Thank you, Travis. Can I have Billy Naylor, Regional Safety Director, McCarthy Building Companies?
Yeah, absolutely. Thank you. I appreciate giving me the opportunity to come on today. So I'm Billy Naylor. I'm our Regional Safety Director for our Southern United States operations. Basically, it's kind of like the SEC footprint. So, I mean, I want to continue to stress what you're hearing today, that this is something that's evolving every minute, every hour. And no one case is like the other. So, as we're going to be going through this call, just stressing the importance of asking all the questions you have. And I know if I personally can't answer it, I'll do everything in my power to get it back to you. So, again, thank you for letting me come on today.
Thank you, Billy and Travis. And Manny, if you can introduce yourself.
Hey, John, again, like Billy and Taylor were saying, thank you for inviting us. I think, like you said, it's an important conversation we need to have, but I work for TAS Commercial Concrete. I'm the safety director down here in Houston, and we have an office in Dallas and Austin. So I'm like Billy, have to worry about other counties as well. So different programs, different behavior patterns we got to include here. But yes, we're whatever we can do to help out and try to mitigate this as quick as possible.
Thank you, Manny. And again, as everyone stated, first I want to thank our three presenters today, because they literally only got minutes notice on this, and they are very, very busy on their own work sites to make sure they're keeping their family work team going. So we're going to try to do this as expeditiously as possible. If you go to the RHCA homepage, it doesn't look very pretty at the top, but we have the information both in English and Spanish, and the original e-blast that went out. So Julio can click on e-alert. And so when we sent the information out, we were just trying to get the word out. And as you can imagine, we want to get source information. So we asked the county from starting on Thursday, when they were talking about iterating something out, we said, we want the English and Spanish to go out at the same time. And they got us the English information out via email, but the Spanish didn't come in until almost midnight. But between Julio and Yolanda and their teams, they were able to get a translation going. So when we sent this out late yesterday evening, the Spanish translation was one that we did internally, but around 2 o'clock in the morning, we updated it with the official one from the county. So what you see in both these links now are the official one from the county. I will also let you know that as far as what I looked a few hours ago, only the English was on the Dallas County website. The Spanish wasn't, but the Spanish version is coming from original source, Dallas County. If you click on our website, if you ever see this Dallas County logo in the middle that says Dallas County, Texas, established 1846, if Julio will click it, it takes you to the county page. And this is the latest information. And if Julio will scroll down, you'll see that there, scroll down further, you'll see here where it says right there, latest orders from Judge Jenkins. That's where you have the full order, and then you go down to the rules. That's exactly what we have on ours. They still don't have the Spanish up, but if Julio will go back and click on English, okay, so wherever you see the English part, it's all going to the same page. So you'll see a lot of clicking, but it's all going to the same page. And I know everybody's internet's a little slow. So before I talk about this part, I'm going to ask Julio to shrink it down a little bit and then scroll down to the bottom. Here's where you see the rules. And then if you go down to the bottom, you'll see the rules in Spanish. And if you see these clicks, if I can ask Julio to click the purple button in the middle of the page, if Julio can shrink it and click the purple button. Yes, and that's the rules in Spanish. This document is the source document. It's not on the Dallas County website, but it is the document that was emailed to us. And so the only reason I want you to see this is so that you know that we're using source information. And I know our internet is pretty slow. So while Julio clicks on that and we try to open that page again, and if you see here are the rules. When they sent us the rules, they didn't put the county logo, but this email did come directly from Dallas County, and I know that's important to us. These are also the rules that we shared to Univision Spanish. And if Julio can go back, and then if he clicks on the brown button there, that's the order in Spanish. That's the full order that gets amended on there. And as for you safety professionals, they made 2 documents, but always refer back to the order itself, because on some of the items, there's just a little bit more information that they offer. If we can go back to that page, Julio, the RHCA page, scroll to the top, and if you were to click the maroon button and the blue button, you're getting the same thing here, the rules, and then the full order. I strongly advise that for safety professionals and people inside your company, that you click the full order, because that just has a little bit more specific information, and things were moving so fast. There's some items there that the judge had said that wouldn't be in there. As of right now, they are in there. I would periodically go back and check those as to make sure that you're current. And at this point, it looks like what we're looking at is just the interpretation of some of these points. And as they did go into effect yesterday evening at 11:59 p.m. on March 29th, so we're in full force in Dallas County. We're asking companies to default to their most jurisdiction with the most restrictions, so that all your employees are following pretty much the same rules. And with that, we'll scroll down just a little bit. And here we have these preambles, the stay-at-home safe rules for the construction industry. I'm not going to read this, but I would ask you to take the opportunity to read this. And I'm going to ask Billy and Travis to read this, and then offer any examples on how they're interpreting that at McCarthy. Now, people, we did invite some from Dallas County. As you can imagine, they're very busy right now, but they were trying to get somebody on board, because we would love to have the rule makers interpret the rules for us. But these rules basically came from the National Construction Safety Coalition, and then Dallas County put them together in this fashion. I think a lot of the rules that are going on are rules that most of us have already implemented. And I would also like to say that the representatives from McCarthy, they're not telling you what to do. They're just relating on the points, and they're sharing how they do it at McCarthy, right? Every company has their own different rules on how they want to implement things and interpret things. We asked our McCarthy friends just to review how McCarthy's doing that. And so with that, I'm not sure, I think Billy was going to go over the points. So Julio, will you scroll up a little bit so we can see all the points at one time?
Yeah, I can definitely. I mean, when you look at the first 2 right off the bat about mandatory temperature checks, it's going to be important that you sit down with your crews and you educate them on, the more data you can find on why you're asking them to do checks of their temperature, being that the fever is like one of the biggest triggers of this that gets you into what is the so-called symptoms. So it's not so much asking them to do it, it's the why behind it, because that's going to get you the value to it. The next part, if you look at number 2, right now for us internally, we are in the process of hiring third-party medical professionals to come to our job to handle this. On each project, that should be fully implemented here by the end of the day. We just felt that would be the best way to handle it. The shift work right now is being dealt with project to project. I think, if you heard him talk earlier, it's like, I don't think there's a one size fits all for your project. But at the end of the day, these are things we're going to have to guide by. The one thing I definitely want to stress at is like 5 and 6. I think each of us are going out in the public settings, and you're going anywhere, and you're seeing maybe a lack of social distancing happening. I can tell you right now, I'm in Houston, Texas right now on a project that has a possible positive. And the number one conversation that's going on is, was there social distancing in place? What measures are we, are making sure across the job? So please, when you're talking to your crews, and especially when you look at number 5, when you're setting up lunch breaks or just regular breaks, that you are giving the crews the availability to space out to that 6 feet. It is a change, and it is totally against something how we behave as humans. We love to interact. We love to be close when we communicate. So please push that, because at the end of the day, by following the CDC guidelines, that is how we're going to limit the restrictions. Number 7, obviously, is an example of change that's happening versus having one large water cooler on the job. You're looking at individual water bottles. What we have been saying to that is we're leaving it up to each subcontractor on the job to run the program the way they want to run it. Just make sure they comply with it. Number 8, we have allowed all our non-essential employees who have the ability to work from home to work from home. We find it's beneficial to do that. We're still getting the amount of work we need done, but limiting the footprint on the job site. Number 9 has been in place for us for a while, providing soap and water and hand sanitizers in all place. Number 10 is probably a little bit of change for all of us, and that is the mandatory hand washing of 20 seconds for workers. What I would just encourage is, in your morning tailbox topic in your meetings, this is your discussion points. And then somewhere during the day, maybe right before you're taking lunch break, this conversation is happening again. The one thing I definitely would like to stress through this whole thing is, now is the time for over communication. In order for this to work, it cannot be a one-time conversation with folks. It's going to have to be over and over and over and over again, because people like to backtrack to normal, when at the end of the day, that's not the scenario we're in. Maybe a week or 2 from now, when this is all pretty normal, it'll be a little easier, but it is our job as the responsibility to make sure that we're over communicating. Someone just came across the text line and talked about the fact of how hard it is to get thermometers. That is actually correct. If you read the whole order in its word by word, number 2 actually has a part on it that says to your best ability. So they are saying, hey, we understand, but what they're saying is you need to have something in place. So in place would be, hey man, we have everything, thermometers are coming, this is what we're doing, versus nothing in place. Number 11, mandatory rest breaks. The good thing, Dallas County's had this in place for a while, so we've all been living by it. What I would encourage is, if you're coming onto a job site with a GC, make sure you ask them what the times are, and that way they can figure out if they're staggering those breaks, where you would fall into that category. Or honestly, don't be afraid to vocalize what's best for you and your crew. The sanitary issues, that has been addressed on our end this morning, providing making sure enough toilets on the project. No adverse action. So number 13, very important, no adverse action taken against an employee who has been quarantined or advised to self-quarantine. What I've heard, and I don't have physical contact with this, but I have been a part of a conversation where they've almost turned an individual into a negative situation. That's not what we want. At the end of the day, we want to respect everybody. At the end of the day, we ask that employee to go home out of courtesy for everybody else and also to follow the CDC guidelines. But we want to open that person up in open arms back to our job site once all the restrictions have been met, because at the end of the day, that employee is going to come back feeling a little tense anyway. So the better we are at welcoming that person back and letting them know how much we care and love about them is going to help that process out a lot. And then designate COVID-19 safety monitors. So I would encourage that you're pushing your foremans to this. Again, I would encourage, this is a document you have printed out that is attached to your morning safety huddle, and this is being discussed 2 or 3 times a day.
Okay, thank you so much. You know, when we talked about enforcement, we went over, this was, as you can imagine, it was a big topic of discussion. And this is the sentence that came out. Failure to strictly comply with this order can result in penalties described below. Additionally, the general contractor and non-compliant subcontractor can be removed from the essential business list. You know, we asked, what else is there? You know, what other penalties are there? And they said just what we said below. Additionally, the general contractor. So when talking to the county, they're not wanting to make this punitive. What they're wanting is just to get all of us to obey these directives and consistently. So no one's there wanting to be a bully or anything like that. What they want is adherence. And so that's why we quickly scheduled this webinar. The targets are moving so fast. When they had the press conference yesterday, it was supposed to be all about construction. But then they had the needle move a lot on nursing homes. So if you were able to see the press conference yesterday that Judge Jenkins did, it was 99.9% nothing about construction, but all about the nursing home situation, where he was asking people that if you could take your loved ones out because the virus spreads quickly, and they have a higher mortality rate in the nursing homes. And so the target is still very much moving. I did have a question about the elective construction and maintenance, and this was the clarification that they provided us. This referred to any new construction, including but not limited to additions, alterations, conversions, expansions, reconstruction, renovations, rehabilitations, and replacement that is primarily intended to increase the value or aesthetics of residence or business. Construction or maintenance needed for the safety or continued use of residence or business is not considered elective under this order. What the county and other elected officials had is a backlash of people complaining about what they see. And unfortunately, you know, you don't get the full picture. So we had somebody complain about doing a big custom pool in somebody's backyard in Preston Hollow. What they didn't understand, it's easy to say, how is that not a priority? Well, when you have a big 12, 15-foot huge hole in the back of your ground, and it's been raining like crazy the way it is, and we have quite a bit of sinkholes here in the Dallas area, it's just not safe for big structures, whether the house on the property or the house to the left or right of it. It does create some instability. Plus, children are home right now, not in school, so you don't want to have a hole that big in your backyard with children there at the house. And with all the rain, mosquitoes are coming in strong. That leads to health issues for the whole community in that area. So yes, no one's going to say that that pool is essential, but the hole's already in the ground and we need to finish it because it's more of a health hazard than not finishing it. So they're talking about new things going on, and I know that was one of the Q&A questions. This refers to new elective construction and maintenance on there. A second complaint that I read came out of a big project, and it's a company that we all know. And yes, you may be seeing what looks like a remodel, but in some of these companies that infect our infrastructure, there are IT situations there that is on a need to know basis. And so while you may be seeing somebody just remodel a wall or floor, you don't know the kind of wiring and information that's on the back end. Even if you work at that company, you may not know the type of construction that's really going on there. So we have to be careful of the work that we're doing, because people are taking pictures, putting it on Facebook, sending it to elected officials, and there is a backlash. And so what my response to that is that I'm not going to worry about those people taking pictures. I'm going to be worried about our members and clients adhering to the policy so they can keep their workers safe. But I do want you to be aware that there is a backlash on this. A lot of it is third party. A lot of it is in the residential. And again, that just makes sense, because those companies and projects are just smaller, and they're just more of a moving target than somebody who's building a school or remodeling the school. These, like I said, these points are in Spanish. We're looking at doing this same type of presentation in Spanish, but the documents are all here. I want to ask Julio if you will please click into the source document, into the order. Julio, if you'll scroll to the top, it's the second one, yes. Scroll down to the numbers, Julio, to where the points are. I will tell you that if you go to number 11, XI, Roman numeral 11, there you go. I would recommend that you come down and especially if you're working with a company, because if you look at 99, gives you the degrees there. Workers need to start testing at home before they get to the work site, and then we need those forehead thermometers. But if you've been like us, it is difficult to find these materials. A lot of people have them on back order, but they haven't come in. The county understands that we're getting those as soon as our GCs and subcontractors are getting those, they're pushing them out to the work sites. But just understand that you may not be able to have those forehead thermometers right now, and nobody's telling you to get one thermometers and place in everybody's mouth. They're stressing get the forehead thermometers, but even better to get the workers to take their own temperature at home with a regular thermometer before they come to work. There is a shortage of not only thermometers, but the batteries that go into those thermometers as well. So just be aware that you may want to let your COVID-19 monitors know, whoever that assigned foreman is, that to be aware if you don't have those thermometers on your project, that they're able to answer any questions as to what your company is doing to get those thermometers in hand. The other sticky widget on this one is number 3, where it says shift work must be implemented such that each shift shall have no more than 50% of the workers who work on shift on March 16, 2020. Once assigned to a shift, workers shall not change from one shift to another. So what they're trying to do is stop the traffic of how many people, are interfacing with one another at each point. When one iteration of this, we were assured that this portion of this will be taken out, because if you're a really small company, you may only have 3 or 4 or 5 people there. But on this one, until we get further clarification, I would follow the making sure you follow the social distancing, and to understand that there is a dispensation in there that some things just require, a bigger group of people to do it to make it safe, right? So you may have 5 people that are holding up some unit that you're installing. They're not keeping the social distance as they can, but in order for that project to be safe, you need that many people making sure that things don't fall and that things installed properly. But I just want you to know that RHCA is working on further clarification on number 3, because I know, especially for the smaller companies, that may be pretty hard to follow. But if you'll scroll down just a little bit more. Some of the points here read just for word that's going on there. I'm going to look at the questions on the residents. And so I may need Billy or Travis or
Hey,
Matt
John.
on this.
Hey,
Go
hey,
ahead.
John, real fast, if you don't mind. So the one thing I want everybody to understand is when you're looking at taking temperatures, the one thing that what we're learning from sitting through these webinars with lawyers is that you are now creating a medical document. When you're taking, if you are tracking it and writing it down on paper. So remember, there are some HIPAA laws, and there's actually time on what that document has to be saved. So that's why we have been treading lightly on actually documenting what it is versus just taking the temperature.
Thank you. Thank you. And that's the other thing. We do have to, right now, the target is moving. But when this ends, there may be a time that people start going through this with a fine-tooth comb. And we want to be respectful of everybody's privacy. So as you're creating information, you want to make sure you have the right information to follow through, but you want to be very careful that you're not creating medical records for people, but you are following through on the actions to keep your people safe. So you want to have thorough documentation, but you want to have limited documentation because you want to be respectful of everybody's privacy. Go on to, and please, will the other panelists just jump in if you think a comment is something that our audience needs to know, and then if you could help me with the questions. And some of these we may have already answered. On the residential side of the construction industry, home building doesn't seem to be slowing down. Interior designers are still having face-to-face with the new buyers from the interior finish. I think that this is one of the clarifications. The first backlash really was on the home builders, and today's the first day of implementation, and there's a big push to make sure that the Home Builders Association is really getting the word out on this. So I think you will see a slowdown, especially on the meetings of new things, because that's spelled out very clearly in the clarifications. Question number 2, Dallas County amended order dated March 29th for construction. The order states taking temperatures of employees. Is the GCs responsible to monitor the subcontract employees, or the subcontractors responsible for this? Right now, we asked about this too, and unless they change something here that I haven't read, it was everybody's in charge of their team, right? It wasn't, as far as I know, it hasn't been anything that the GC is responsible. Travis, Billy, has they said anything to you about the subcontractor workers? Are y'all supposed to be doing those, or they're just asking for your team?
I just going by and reading the order itself. When I see contractors and supervisors, to me, that is going back to your point, is you are in charge of your own team. That's how I read it. Unless somebody has seen a different wording on that, I see that as each employer is responsible for their own employees.
So, and I think every GC knows that they want to make sure that rules are impacted on their project. So it is a responsibility that we take on all the time, and this is no different, but the actual doing of that, is on that individual team. As far as on the thermometer, there is no language saying they need to wait. But the judge and the people of the county do know that they're pretty scarce right now. And so what we came up in response to that is just to have an explanation of what you're doing in order to get thermometers. We've asked, and we're trying to get a list of places that have it so we can put that online. And some of them have restrictions on the number of orders. And quite frankly, some people are getting thermometers. They are paying a hefty price for them. And several people that I talked to, there's a back order of 1 or 2 weeks minimum. But we will start reaching out to develop a page of links of maybe where people can do those thermometers. If we do put that website on, you're still going to have to do the due diligence that these are reputable companies. We'll do as much as we can on the front, but since you'll be doing the transactions, we'll need you to do that as well. Can we complete elective construction and maintenance outside of Dallas County if our headquarters is inside Dallas County? Right now, this order is just for projects in Dallas County. We're asking just to eliminate confusion that you do that for all this area. In fact, in all your projects, you adhere to it, because one of the things that the Dallas County has been doing is heavily lobbying surrounding areas to adhere what Dallas County is doing, as well as other areas in the state. Clay Jenkins is in constant communication with the governor and has been pushing him to implement the same rules Dallas County is doing. And also, he's in communication with Tarrant County, and I know that he was really pushing Collin County to adopt the exact rules Dallas County was. And their exact wording, when I talked in a conversation that I was with them, was they wanted to be known that where Dallas goes, the state will follow. So in order to, I would say start implementing that company-wide, just so that there's not any confusion if you're telling one team to do one thing and one team to do the other. I feel that most of these rules our teams are following already, regardless of whether they're mandated or not from Dallas County. Do they need to be a no-touch, i.e. an infrared? Yes, the thermometers need to be those forehead ones, not the ones that you use orally. So they're trying to minimize contact. What third-party company is McCarthy using for temperature checks? Phillips May would like to look in to do this. And before McCarthy answers that, we are also partnering with a company that works with several of our major GCs. But if McCarthy, if you want to, if you're comfortable sharing what company you're working with, if not, people would just have to.
I would say. Yeah, it's not that I'm uncomfortable, but so there are medical directors. So we have a staff of doctors who are on retainer with us all the time. So they are already, in-house already. So they are providing third-party folks to get it to us. And I can tell you all you really need to do is reach out to whatever your clinic you're dealing with is. But again, I can, tell you there's not a bounty of folks out there right now. It's taken us normally 2 to 5 days to get somebody on board. So it's something what I would encourage looking back. I wish I probably would have been a little more aggressive from the get-go thinking this was coming. So I would encourage you, especially if you're someone like me who has work outside of Dallas County, everything has followed suit pretty well so far. So it wouldn't hurt to be proactive about it.
Okay, thank you. I think the best bet is to, just like was said, was reach out to the people around you who you're already working with. We're going to put some, we're working with a company now, so we'll put that information. If not today, it'll be out there tomorrow. And that company, we have done some research and done some due diligence, but reaching out to your regular providers, your regular clinics that you're dealing with right now is your best bet. Everyone is super stretched. We have not reached, we have not started to plateau yet. What we're trying to make sure is that we keep all our workers safe consistently, and that we're trying to that we work on following the rules, that we're moving it upstream and downstream so that we keep people safe, and that people are aware that this information is just moving day by day. I have started to get some reports that some of the construction sites already have some workers that have turned out to be COVID-19 positive. I haven't gotten any reports yet that they know that the source of this was a construction site itself, but there has been reports that people, workers who were part of the general public as well, have been exposed. And if we get an uptick on this, that'll be a game changer. So we have to keep our workers safe and the job site safe. I do want to go back real quick before we end. If people can go back and Julio, go back to our homepage and scroll down, Julio, to the bottom of the page. And if you see this where there's a bunch of information here on our resource page and things. Julio, go back up to the page as well. And if you click on protecting workers during a pandemic, and there's certain links in the middle there, there's a link on how to keep your tools clean, because that can be a simple process, but part of the points is that, you know, we're cleaning these tools and that we're not cross-contaminating by letting other people come in and use those tools. And if you are, wash your hands before and afterwards. And I can tell you, I feel like I'm a germaphobe and I wash my hands continually throughout the day. What I didn't know is I don't wash my hands for 20 seconds. And that's been a whole learning education for me, is singing the little happy birthday song while I'm washing my hands I'm taking much longer than I normally take to wash my hands. So I think that 20 seconds for most of us, you know, it's a short time, but I don't think we're used to doing that as much. So make sure you do those kind of things. Do the 1,000, 2, 1,000, or the birthday song or something. Understand on these cleaning materials. I know people are, you know, some of these the chemicals that we use are hard to get to. So some people are using more industrialized things, but we do have to be aware that some of these are just stronger than we're normally. So we have to be extra careful with those chemicals. Manny, did you have any information that you wanted to add?
No, John, but you're right. Just make sure you also put your SDS on your job site, because that's one thing we are doing as well. We're buying a lot of these products to put at the job site, but we put the SDS with the guys, and like you said, they make sure they wear the right PPE for that. But like Billy was talking about, hey, we're a subcontractor. We have 1,700 employees, and we do have our program, and we're making our superintendents accountable for their crews and trying to minimize them. One thing I did notice, at least from the subcontractor perspective, is a lot of the guys eating together. And like Billy said, not to have them eat together, but they bring lunch and they share the lunch. Just kind of remind them not to do that. And that's just a common practice in the industry. You know, hey, you want a taco? So everybody reaches in and grabs from the same lunch. So just Billy hit it right, not just remind them. That's just friendly reminders. It's just some habits that we're trying to get away from.
I think we see that. I see during like the conferences when they're talking about being clean, and one of them will go up there to the podium, and then when the other one's coming, they'll move 6 feet away, but they both touch the exact same thing. You know, they touch the same areas of the podium, and they're scratching their face and they're, you know, wiping their eyes and things like that, because it's just so natural that we do that. So even the people that are trying to get us to do the right thing, it's hard because, you know, we're so used to doing that kind of stuff. So it is going to be a constant friendly reminder. You know, I hope no one takes it as harassing. It's really, those one steps that are going to save lives. We have another question. Will you be able to provide a copy of this Zoom call? Yes, when you go to the website, there'll be a video of the call, and you can just listen to that as well. Where we all wear gloves and wash thoroughly and regularly, do you recommend masks, N95 or different kind? Billy, Travis, or Manny, can y'all share what this is? If are y'all putting that in place, or how are y'all doing the mask?
Yeah, I can answer a little bit of that. So, you know, early on, I was reading a bunch of articles about, hey, why do you see a bunch of people wearing masks, you know, and everybody's hoarding on these masks. But it is true that it's better to give the infected the actual mask over you wearing the mask. Now, it will protect you, but I would not recommend always wearing an N95 on the job sites. We were able to donate a lot to the medical industry with some of our clients, and we were capable of doing that. But I would say those right now would need to go to other industries currently, especially in the medical field, over our use, unless you are doing essential work and involves using that as a PPE mechanism.
Thank you, Travis. Here's the other thing I will tell you, what I've seen, not on work sites, but just out in the public. I had to go to the pharmacy, and this lady had a mask on, and every time she was coughing, she would lift the mask up, cough everywhere, and then put the mask down. I was at Central Market a week and a half ago, right before they closed it on Lover's Lane, and this whole family came in with masks. As they were shopping, their kids were all over the floor, touching everything. I think if you practice, and this is what I've been told, if you practice social distancing, if you're keeping yourself away, that's going to go a lot more consistent safety habits than maybe putting on the mask where you think that you think you have a safety barrier that you may not be using as effectively, and you're letting your guard down. The CDC has stressed over and over again that what you want to do is practice the social distancing as much as possible, and that's going to be the biggest barrier of you. That's why they sent, so many people home, is so that we can, keep people safe as we're trying to weather the storm. I know there's a lot of conversation in the chat part where we're talking about getting these supplies, and it is hard to get the supplies. If we come up with any sources, we'll send it out. Sometimes supplies open up for a little while at Fastenal, at Granger. Sometimes if you're a big GC, you just have a good, you have a good relationship with your suppliers, so as they find out, they're bringing stuff to you. But everyone knows these supplies are really hard to get to. I'm hearing right now that a lot of people have been able to order stuff, but there's still a 2-week backlog. I know a lot of the planes that are not flying public anymore are still trying to bring in some of these supplies. Other people are worried because these supplies are still coming from China. But as we get information, we'll send it out if we hear of any big suppliers that come in. But that is going to have to be something that everyone's just constantly on the lookout for these information. But we did keep the information. We do know that the county and the governor's office know that it's really hard to get a hold of these, and it's really hard to get a hold of batteries. I wanted Manny, can you talk to us about how you set up these ad hoc water stations?
Okay, yeah, well, we did a couple, we're the concrete guys. We're the first ones to get there. So sometimes we don't have enough water. So what the guys did, they end up using their water container units and actually remove the spout and put a valve so they could actually wash hands. So they have like 3 to 4 at the job sites. And then we provided soap as well. So they're able to wash their hands and at the same time, and bought some disinfected chemicals so they could disinfect that area as well. And at one job, we have one guy all his job is make sure he disinfects, and he's the one who turns on the water and turns it off. Like, well, you go to the club, that's that guy. So just kind of real simple stuff. And the hand sanitizers, we bought a couple cases. There was a subcontractor down here, a vendor here in Houston that went to a brewery, and they're making actually alcohol to drink and the hand sanitizer as well. So there's some stash out here in Houston as well. But that's what we're doing, John. And reminding the guys out there.
Thank you. And that's what we did as advocates is we let the government officials know that we have people trying to do the right thing, but there is a scarcity of supplies. And we'll continue to do that. as we hear places we can order this, where we'll share it with you as much as possible. But just much like the doctor, go to your regular suppliers. They're the people that are used to working with you, and they want to make sure they continue to keep you as a customer. So that's where I would start. If we hear of anything, we'll get it out. Before we close, I'm asking everybody to please share this information upstream, downstream. Social media is one of the most highly used tools among Hispanics, and so we have an English Facebook, and Julio will click into the Spanish Facebook. And if you get Facebook in Spanish, Facebook translates a lot of what you post already. So I think I do it in English, so our Spanish one will be in English, but we post stuff in Spanish in it. But it's important that we really spread this information out. We will have the link to this webinar on our website shortly. It'll take us about 30 minutes to clean it up, and then we'll put it on our website. But if you can go to our homepage, some of our social media is on top there. We have it on LinkedIn. We have it on Twitter. We have it on Facebook. We have it on Spanish Facebook, which is that Enya sign that you see there. That third one is the Spanish Facebook. The second one is the Luna Facebook, and the first one's our main Facebook. We don't have Instagram on here, but we do post it on Instagram as well. You can direct people. If you get the link, it's easy just to text the link out there. But if we want to keep our workers safe, and we want to make sure that we're keeping our job sites safe as possible, you don't have to send our information out, but please send out some information and have your workers and your supervisors and managers in your company spread the word. One last round. Are there any more questions before we close? Okay. We're going to ask also in the email, we've been sending out a survey. That survey is more of a business survey and how COVID is affecting business. And if we're asking everybody to please complete that survey, it just takes a few minutes to complete it. But we're asking that you would. It's right there at the bottom of our homepage. It is in English, and we are calling all our workers, and we're scheduling one of these presentations in Spanish. And with that, ladies and gentlemen, thank you so much for participating. Especially, we thank our panelists who we know are busy. We want to thank McCarthy, Kamisha, Mason for just jumping on this and helping impact the greater community of contractors, architects, and engineers. Thank you, ladies and gentlemen. Thank you, Travis. Thank you, Billy, and thank you, Manny.
Thank you, John. Have a good one.
Thank you.
Thank you. Have a great day.
Appreciate it.